Hi, I'm Kim Evans. I'm the CEO of Affect Hope, and I'm shooting this video from my socially distanced apartment in Richmond Hill, Ontario. I wanted to take this opportunity to share with you how our work at Affect Hope to end neglected tropical diseases is being impacted by the COVID-19 pandemic. But first, I wanted to share that we at Affect Hope and I personally am so grateful for the government leaders at all levels of government who are providing excellent leadership and creative solutions to help us navigate these uncharted waters. I'm grateful too for the doctors and the nurses and the paramedics and for the technicians that support them, and even for the grocery store workers who are working hard to keep us safe and to help us survive in these trying times. I'm grateful too for Dr. David Williams, who is the Chief Medical Officer of Health. David is no stranger to our friends at Affect Hope, as he was a former board member. And we are praying daily for him as he leads the charge in our medical response to this important situation. I'm also encouraged by the creative ways that others are responding to the situation that we face. People are coming together and finding ways to be working together, to be socializing together, even though being socially distant. Churches are figuring out ways to deliver Sunday morning services remotely. They're figuring out ways to care for their seniors. Companies are switching their manufacturing from alcohol to hand sanitizer. Organizations like ours are learning to use Zoom and other video conferencing options in ways that we never imagined. We even tried to sing a worship song on Zoom. To be honest, I don't recommend it. And I'm thankful for the team I have here at Affect Hope, women and men who are committed to see our mission continue to move forward. Like many of you, they're all now working at home. Some of them never imagined that that would be what they did. Now more than ever, our commitment to the people we serve remains. Having said that, it is an adjustment to work in physical isolation, or sometimes it's an adjustment to work with your family all around you. And our people have anxieties just like the rest of you, and we're helping them to work through it. Our partners in program countries around the world have also had to make changes in the way that they work. And we need to continue to pray for them. Some of their staff have been able to work at home, but others, medical teams in particular at some of the hospitals we support, are similar to our hospital staff. They are working round the clock and are at risk of infection. Nonetheless, they continue to work and to keep a safe distance where possible. They are administering the essential treatment that patients with leprosy and other neglected tropical diseases need. But the family members, their family members, are concerned for their welfare. Please remember to pray for them and their families. We also need to pray about blood banks. One of the partners wrote to me just last week and said that they sadly lost a patient who suffered with anemia and was also suffering with leprosy. And that if they had had only one unit of blood available, they would have been able to save that patient's life. Please pray for these people, the workers, but also the families of people who are being affected in ways that we haven't really considered. For an organization like Affect Hope that is over 125 years old, we've been through a lot of crises, but COVID-19 is a unique challenge to us. To our donors, we understand that this is a challenging time for you. And for those of you who are choosing to stick with us, we say thank you. Thank you from the bottom of our heart. Thank you on behalf of the men and women suffering with leprosy, with lymphatic filariasis, with Buruli ulcer, with other neglected tropical diseases. Thank you on behalf of the doctors and the nurses and the project workers that are working in countries like India, Bangladesh, Liberia, Nigeria, Cote d'Ivoire, Congo, and others. Thank you. You are making sure by your support that our work continues to go forward. You are making sure that we continue to be able to help those who are suffering with various neglected tropical diseases. You are providing them hope. Some of you have emailed and asked, you've emailed and actually offered to encourage us. And some of you have even asked how you can help more. We're grateful for that. Wow. We are so encouraged by your care for us as a ministry. The speed and the spread of COVID-19 is disconcerting, to say the least. But we are thankful that none of this is a surprise to God, and that He, and not us, is in control. Please join us as we pray fervently for the disease to change course, the virus to recede, and the numbers of those infected to decline rapidly around the globe. Our team prays every morning at 9 o'clock on Zoom. Please email us if we can pray for you at prayer@effecthope.org, or call us at 1-888-537-7679, and our staff would be more than happy to pray for you and with you. As an Irish columnist, Fintan O'Toole has said, the spread of coronavirus has shown us that none of us is safe unless all of us are safe. So please take care of yourself, your family and friends, and the community around you. And don't forget to wipe those counters and wash your hands. Together we will get through this and thrive again. Thank you to all, and be well.